We have a lot to get to. You're passionate about the housing crisis, I can tell. But Nora?
Thank you. One of the top problems facing Americans is the high cost of health care. Senator Vance, at the last presidential debate, former President Trump was asked about replacing the Affordable Care Act. In response, he said, "I have concepts of a plan." Since then, Senator, you've talked about changing how chronically ill Americans get health insurance. Can you explain how that would work? And can you guarantee that Americans with pre-existing conditions won't pay more? I'll give you 2 minutes.
Well, of course, we're going to cover Americans with pre-existing conditions. In fact, a lot of my family members have gotten health care. I believe, members of my family actually got private health insurance, at least for the first time, switched off of Medicaid onto private insurance for the first time under Donald Trump's leadership. And I think that, a lot of people have criticized this concepts of a plan remark. Look, it's very simple common sense. I think as Tim Walz knows from 12 years in Congress, you're not going to propose a 900-page bill standing on a debate stage. It would bore everybody to tears, and it wouldn't actually mean anything because part of this is the give and take of bipartisan negotiation. Now, when Donald Trump was actually president, and again, he has a record to be proud of, prescription drugs fell in 2018 for the first time in a very long time. Under Kamala Harris's leadership, prescription drugs are up about 7%. Under Donald Trump's entire 4 years, they were up about 1.5%. He introduced pricing transparency. Think about healthcare. You go into a hospital, you try to buy something, and nobody knows what it actually costs. That price transparency will actually give American consumers a little bit more choice and will also drive down costs. And we talked about, the reinsurance regulations is what I was talking about. Look, Donald Trump has said that if we allow states to experiment a little bit on how to cover both the chronically ill but the non-chronically ill, it's not just a plan. He actually implemented some of these regulations when he was president of the United States. And I think you can make a really good argument that it salvaged Obamacare, which was doing disastrously until Donald Trump came along. And I think this is an important point about President Trump. Of course, you don't have to agree with everything that President Trump has ever said or ever done. But when Obamacare was crushing under the weight of its own regulatory burden and health care costs, Donald Trump could have destroyed the program. Instead, he worked in a bipartisan way to ensure that Americans had access to affordable care. It's not perfect, of course, and there's so much more that we can do. But I think that Donald Trump has earned the right to put in place some better health care policies. He's earned it because he did it successfully the first time.
Governor?
All right, here's where being an old guy gives you some history. I was there at the creation of the ACA. And the reason it was so important is I come from a major healthcare state, home of the Mayo Clinic, home to Medical Alley, 3M, Medtronic, all of those. We understand healthcare. It's why we're ranked first on affordability and accessibility and quality of healthcare. And so what I know is under Kamala Harris, more people are covered than they have before. And those of you listening, this is critical to you. Now, Donald Trump all of a sudden wants to. Go back and remember this. He ran on the first thing he was going to do on day one was to repeal Obamacare. On day one, he tried to sign an executive order to repeal the ACA. He signed on to a lawsuit to repeal the ACA, but lost at the Supreme Court. And he would have repealed the ACA had it not been for the courage of John McCain to save that bill. Now, fast forward, what that means to you is you lose your pre-existing conditions. If you're sitting at home and you got asthma, too bad. If you're a woman, probably not. Broke your foot during football, might kick you out. Your kids get kicked out when they're 26. Kamala Harris negotiated drug prices for the first time with Medicare. We have 10 drugs that will come online, the most common ones that'll be there. But look, this issue, and when Donald Trump said, I've got a concept of a plan, it cracked me up as a fourth grade teacher because my kids would have never given me that. But what Senator Vance just explained might be worse than a concept, because what he explained is pre-Obamacare. And I'll make this as simple as possible because I have done this for a long time. What they're saying is, if you're healthy, why should you be paying more? So what they're going to do is let insurance companies pick who they insure, because guess what happens? You pay your premium, it's not much. They figure they're not going to have to pay out to you. But those of you a little older, gray, got cancer, you're going to get kicked out of it. That's why the system didn't work. Kamala Harris will protect and enhance the ACA.
Governor, thank you. Senator, you have not yet explained how you would protect people with pre-existing conditions or laid out that plan.
Well, look, we currently have laws and regulations in place right now that protect people with pre-existing conditions. We want to keep those regulations in place, but we also want to make the health insurance marketplace function a little bit better. Now, what Governor Walz just said is actually not true. A lot of what happened and the reason that Obamacare was crushing under its own weight is that a lot of young and healthy people were leaving the exchanges. Donald Trump actually helped address that problem, and he did so in a way that preserved people's access to coverage who had pre-existing conditions. But again, something that these guys do is they make a lot of claims about if Donald Trump becomes president, all of these terrible consequences are going to ensue. But in reality, Donald Trump was president. Inflation was low. Take-home pay was higher. And he saved the very program from a Democratic administration that was collapsing and would have collapsed absent his leadership. He did his job, which is govern in a bipartisan way and get results, not just complain about problems, but actually solve them.
Governor, did enrollment under the Affordable Care Act go up under the Trump administration?
It's higher now that we've seen it go up. Look, people are using it. The system works. And the question about this of young people or whatever, that's the individual mandate piece of this. And Republicans fought tooth and nail saying, well, Americans should be free to do this. Well, then what happens is... So you think the individual mandate's a good idea? You shrink. I think the idea of making sure the risk pool is broad enough to cover everyone, that's the only way insurance works. When it doesn't, it collapses. You are asking pre-ACA where we get people out. Look, people know that they need to be on health care. People expect it to be there. And when we are able to make it, and we are making it this way, when we incentivize people to be in the market, when we help people who might not be able to afford it get there, and we make sure then when you get sick and old, it's there for you. Because I heard people say, well, I don't want to buy into Medicare or whatever. Good luck buying health care once you get past 70. So look, the ACA works. We can continue to do better. Kamala Harris did that. The way she made everything better was negotiating those 10 drugs on Medicare for the first time in American history.
Thank you. Margaret.
Can I address that?
I apologize. We're out of time. We have a number of subjects to discuss. Margaret.
Let's talk about families in America. There is a child care crisis in this country, and the United States is one of the very few developed countries in the world without